We're here at the Pahrump Nugget this evening for a town hall meeting that was called by Healthcare Partners Medical Group. If you're not sure who they are, just think about advanced medical and specialty medical, some of the places that you're used to going on a regular basis. Both of those companies are now Healthcare Partners Medical Group. They were bought out by them. Now you're going to have a lot of the same doctors to go see, but there are some issues dealing with seniors specifically and some insurance issues that they want to talk about and answer some questions. So Vern Van Winkle did speak with Dr. Batty, and we'll also be speaking with Dr. Tenori about these issues.
About 400 people showed up here about the letters and information that they had gotten from the insurance company, healthcare partners, Sierra Health and Life, and Senior Dimensions, that they have stopped their contract with their local physicians here, and they're diverting their patients to other providers. And I think there's a question and answer session to respond to questions that the patients, mostly the seniors, have had.
A lot of confusion on what they could do and what they can't do. Can you clarify what exactly this means by the open enrollment and being able to change or not being able to change by October 15th? I mean, a lot of them feel like they're being pushed out today, but do they really have to leave? And can you explain that process?
The open enrollment period is only for senior members that have Medicare, which have given up their Medicare into another third-party administrator, in this case Senior Dimensions or Humana or Secure Horizons. There's only a special time period that they could move in and out of these insurance companies. This enrollment period starts on October 15th and goes up to the beginning of the year. And as the beginning of the year, they will be enrolled in a new program. The beneficiaries have been called and asked to make a change in their provider, and their deadline is September 30th, which is 15 days prior to the open enrollment period. That's why there's so much confusion. This is a real confusing issue for our seniors, and these are the people who are the actual beneficiaries of these things. So I think this meeting here today was to shed light in the questions that they might have, and most importantly, their options. And why we're here today is to tell them that if they're not happy with the change that their insurance company has requested them to have, they have options to do other things. They have an option to go to another insurance carrier. They have an option to change doctors. They have an option to go to straight Medicare. And we were just here to answer these questions for them.
There's going to be more questions for people watching at home. Where do they go to get the answers they need during this time period?
I think the best bet for these patients is to call Medicare. Medicare has direct guidelines of what they can, what they cannot do. I don't think Medicare is biased on which insurance companies they take or they don't take.
How will it affect most of the individuals themselves? What will take place? What will they see in regards to they received a letter, and now a lot of them seem to be panicked. So why are they panicked, and why do they not need to be?
Well, normally, the patients hears about certain doctor and they have experience with them and they choose to have a relationship with that doctor. Now, and I have a patient for 13 years since I've been in this town. I know them as I walk into the room. I don't even have to look in their charts, what do they have. And you know them and you know their family. So you develop a bond, okay, with your patient. It's more than just, shaking hands and so on. And then you come with no reason. We were not given a reason. Our members were not given a reason as to why. Why at the timing? Why the timing is during when you can't change?